In a significant step towards improving maternal and child health outcome, the federal government has flagged off distribution of essential maternal and neonatal health commodities to states across Nigeria under the Maternal and Neonatal Impact Initiative. While providing a progress update, Executive Director, Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Muyi Aina, noted that MAMII has so far been activated in 21 states with 411,493 pregnant women enumerated and 30,587 linked to primary healthcare centers for antenatal care within the past 2 months from July to August 2025. He also said the commodities distribution worth 3 billion naira will commence with 10 states to talk about Bauchi, Borno, Ebonyi, Kaduna, Kano, Katsina, Niger, Plateau, Yobe, and Zamfara, covering 80 parity LGAs and 968 wards as a total of 21 categories of essential maternal health commodities are slated for distribution.
This is an intervention by the federal government, the president and my minister, Ali Pate. And the idea is that if we show and push to fill some gaps and show how these things work and the kind of difference they can make, the states will take it on. That said, our mandate covers the whole country. But when you don't have enough resources or time to go everywhere at once, what you do is you prioritize where the need is biggest, where you have the largest number of women that are losing their lives due to preventable causes. And that's the basis for selecting 10 states to start with as part of a partnership with one of our core partners, And the idea is that even within those states, we're not focusing on everywhere at the same time. We've identified local governments. 80 out of the 172 MAMII local governments are in these 10 states. And that's almost half. Do you get it? So, and that's where we're starting off and looking at all the wards, all the facilities that are delivering women of babies and supporting them with these commodities. This is in addition to the health worker training, in addition to the equipment that we're supplying to these facilities, in addition to the revitalization, the infrastructure, and also quality improvement interventions.
Also speaking swamply, Dr. Dayo Adeonju emphasized the initiative demonstrates government commitment to strengthening PHCs as the first point of care for women and children, while Dr. Mary Brantour, representing World Health Organization country representative, pledged WHO's continued support to Nigeria in scaling up life-saving interventions.
Each state, the 21 states we have been to, they actually have done their annual operation plan, and they have the MAMII implementation plan all inside the annual operation plan, meaning government budget will, be used to fund this AOP, and whatever that is coming from here now is basically to prime the pump, to help support what the government will do. So if government is saying that this is coming, then they need to also release their own fund to support, the continuation of whatever that is being released, at this arena. And this is quite a lot, so government have done a whole lot from the federal. And then we expect that reciprocation of that kind of gesture from the state to save the life of our women and then our children.
This handover is a testament to the power of partnership of all of those gathered here, and to the fact that progress is possible when we align our efforts with national priorities and global standards. As we move forward in this, WHO remains steadfast in our support through technical guidance, capacity building, and system strengthening to help Nigeria to achieve its maternal and newborn health goals.
With the launch, stakeholders expressed confidence that the program will significantly contribute to reducing Nigeria's high maternal and mortality rate while advancing progress towards achieving sustainable development goals.
UNFPA works
with the government of Nigeria to ensure reproductive health commodity security, including maternal and newborn health commodities. It is our fervent wish that this distribution exercise will address the gaps that kept and lead us to curbing stockouts of those life-saving drugs, hence reducing maternal and newborn deaths in our frontline health facilities.
We are with you on this. As you are aware, this government came in and our leadership at the highest level made a very big bet on this government, which is leaning in heavily to support the bold reforms that this government has initiated right from its inception. And as we continue in that support, I've been asked to reiterate that that support continue to work strong. Yeah, there are opportunities that we'll continue to tap together, and also say that today the event is something that is very important to the Gates Foundation.
The flagship program of President Bola Tinubu's administration is designed to rapidly reduce maternal and newborn death nationwide. The initiative is being rolled out across 172 priority local government areas in 33 states regions that account for over 55% of maternal death in the country.